HIPAA Journal reports that in 2022, 707 healthcare breaches affect 52 million patients. When you think of data breaches, your mind might go straight to credit card fraud or identity theft in general. These are both huge risks when it comes to the security of personal information. But when it comes to healthcare, medical identity theft proves to be a serious threat. After all, this is a concern for not only patients, but healthcare providers and insurers as well. But what exactly is medical identity theft? The Federal Trade Commission, or FTC, states that medical identity theft occurs when someone uses someone else's medical information to receive treatment. Medical identity theft can also happen if a medical professional uses a patient's information to submit false claims to payers. Personal information that can compromise a patient's identity can include name, social security number, birth date, an insurance account number, or Medicare number. This kind of identity theft poses different challenges than other forms of identity fraud. Not only does the perpetrator steal their victim's personal data, but they put the patient at risk in messing with their medical data and history. Imagine having a stranger's medical information mixed in with your own. You might be at risk of having your prescriptions changed. It can even limit what health benefits you are able to use. One of the scariest things about medical identity fraud is that it can take a long time to recognize it. Sometimes months go by without any indication. Other times it may take years. The amount of damage done in that amount of time is often devastating to both the patient and the healthcare professional. When it comes to the provider, their first red flag might be the notice of overpayment from an insurance program. This ends in the payer demanding immediate repayment. Providers might also receive a notification straight from the Internal Revenue Service, or IRS. Overpayment letters and correcting credit issues are a few of the consequences of medical identity theft. Sorting out these problems alone requires time, effort, and money. On top of running a business, well, this can put someone out of business. You might be able to take care of the financial aspects of something like this, but the impact of these consequences on a professional's reputation can be difficult to fix. Even if a provider has not done anything wrong, consequences can be severe. Luckily, most healthcare professionals do the right thing when it comes to reporting medical fraud. However, for those few who do not, or worse, actively take part in it, the consequences are even more devastating. Providers voluntarily permitting the misuse of patients' identities can lead to consequences such as civil monetary penalties, criminal fines and restitution, prison time, and exclusion from Medicare and Medicaid. Some common examples of healthcare professionals misusing protected health information include signing referrals for patients they haven't seen, approving certificates of medical necessity, or CMNs, for patients who do not need the service or supplies, signing CMNs even though it contradicts their own documentation of the patient's needs, signing blank referral forms, signing CMNs for more services than what are medically necessary. Providers must be wary of people who want to abuse the system. Those people may try to make a case out of convenience or sympathy that their provider should accommodate one of these requests. Remember that your signature as a healthcare provider holds you liable for fraudulent claims. If you'd like to learn more about avoiding medical identity theft, reach out to eTactics. And you already made it this far into the video, so you might as well like it, share it, and comment below.